This content is for informational purposes only and does not replace professional medical advice. Always consult a qualified healthcare provider for personal health concerns. You possess over 60,000 miles of blood vessels, a vast, complex highway network designed to deliver life-sustaining oxygen and nutrients to every corner of your anatomy. Now, picture that delicate system under constant, unrelenting siege. Hypertension, often dubbed the silent killer, is frequently misunderstood as a condition that only impacts the heart. In reality, it is a structural assault on the vessels themselves. When blood pressure remains persistently elevated, it is akin to forcing a turbulent, high-velocity current through a hose that was never designed to withstand such intensity. Day after day, year after year, this mechanical stress exerts a physical toll on the vessel walls. The smooth, supple inner lining of your arteries, the endothelium, begins to lose its resilience. It is not a sudden catastrophe, but rather a gradual, structural transformation that occurs beneath the surface, often without a single symptom to signal the damage. It is easy to view the body as a static machine, but your vasculature is a dynamic, living tissue constantly responding to the environment you create. When we talk about hypertension, we are really discussing the long-term wear and tear on the very infrastructure of your longevity. Understanding this mechanism is the first step toward reclaiming agency over your cardiovascular health. As we pull back the curtain on this process, it becomes clear that the impact of hypertension is far more nuanced than a simple number on a monitor. Let's examine the specific mechanics of how this persistent pressure alters the interior landscape of your circulatory system. To understand the toll this condition takes, we first have to speak the language of your cardiovascular system, the pulse. This is the peak load your vessels must withstand with every single beat. Conversely, when the heart muscle relaxes between contractions, the pressure drops to its lowest point, which we call diastolic pressure. However, when those numbers remain consistently elevated, this rhythmic cycle transforms from a functional pulse into a chronic mechanical stressor. Think of your arteries not as rigid pipes, but as living, breathing highways lined with a delicate, slippery layer of cells called the endothelium. Under the relentless, pounding force of hypertension, this endothelial layer begins to suffer. Imagine the constant, high-velocity impact of water against the shoreline. Eventually, the soil begins to erode. Research suggests that this ongoing friction damages the endothelium, stripping away its ability to keep the vessel walls flexible and clear. As this protective barrier weakens, the body attempts to compensate, but often in ways that trade long-term health for immediate stability. It is a bit like an old garden hose that has been left in the sun for years. It becomes brittle and loses its capacity to stretch. When your arteries lose that essential give, your heart is forced to work even harder to push blood through the system, creating a feedback loop of increasing resistance and further damage. This is not merely a localized issue, it is a systemic shift in the very architecture of your circulatory network. The mechanical strain changes the way your blood vessels respond to the signals that normally dictate how they should dilate or constrict. By recognizing that hypertension is essentially a physical weathering process, we can better appreciate why managing those pressure readings is so vital for maintaining the structural integrity of your internal landscape. As the walls of your arteries grow less responsive, the way your body manages the distribution of oxygen and nutrients begins to falter, leading us to examine how this structural decline directly affects the flow of life to your most vital organs. To understand why your arteries begin this decline, we must look at the convergence of factors that turn a flexible, resilient system into a fragile one. It is rarely the result of a single event. Instead, it is a perfect storm where your unique biological blueprint meets the realities of your daily environment. While you cannot choose your ancestry, research suggests that certain inherited traits can influence how your body manages fluid balance and vascular tone, effectively setting a baseline for how your vessels react to internal pressure. Some individuals are simply born with a predisposition towards stiffer arterial walls, meaning the threshold at which damage begins may be lower for them than for others. Your lifestyle acts as the primary catalyst that either accelerates or mitigates these inherited tendencies. Consider the impact of high sodium intake. When you consume excess salt, your body works to dilute that concentration by pulling more water into your bloodstream. Over time, this chronic state of overinflation acts like a constant, low-grade stressor, subtly reshaping the architecture of your vascular lining. Coupled with this is the quiet danger of a sedentary lifestyle. When you remain inactive for long periods, the natural signals that encourage your vessels to dilate and contract effectively go dormant. Without this regular, physical workout, the inner lining of your arteries, the endothelium, becomes less efficient at managing the chemical signals required to keep your blood pressure within a healthy range. We must also account for the inevitable progression of time. While this is a universal human experience, the combination of a sedentary routine and poor dietary habits can fast-track this aging process, causing your vessels to lose their youthful resilience decades earlier than they otherwise might. It is this intersection of nature and habit that determines the speed of your vascular decline. This internal hardening doesn't just happen in a vacuum, it dictates the efficiency of your entire system, setting the stage for the specific, localized damage that occurs when high pressure meets vulnerable tissues. Because this damage unfolds deep within your arterial walls, it often proceeds in total silence. You might feel perfectly fine while your cardiovascular system is silently adapting to an environment of chronic stress. Most people living with hypertension do not experience outward physical manifestations for years, which makes consistent monitoring far more vital than waiting for a symptom to appear. However, your body does possess a subtle language of distress, and there are moments when the pressure becomes high enough that the system can no longer mask the strain. These are not merely inconveniences. They are urgent signals that your vessels are struggling. Take, for instance, the sudden onset of a severe, throbbing headache. While we all experience tension, a persistent or unusually intense pressure in the head can sometimes be a direct result of blood vessels in the brain reacting to extreme systemic stress. If you notice persistent blurring, flashes of light, or a sudden change in clarity, it may indicate that the tiny, fragile vessels supplying your retinas are experiencing the brunt of elevated pressure. Research suggests that these ocular changes serve as a window into the state of your wider vascular network. When your heart must work against constant resistance to push blood through hardened, narrowed pathways, the entire body eventually pays the price in energy efficiency. If you find yourself unusually winded or exhausted after activities that once felt effortless, it is worth considering that your circulation is no longer operating at peak capacity. It is important to understand that these signs are not definitive proof of a specific crisis, but they are meaningful data points that your body is providing. Studies indicate that early identification of these subtle shifts is the strongest tool we have for intervention. While your vessels may be hardening in the dark, you have the power to illuminate these changes long before they result in permanent damage. As we begin to recognize these warning signs, we must also look at the specific, high-stakes environments where this pressure does the most harm, particularly within the delicate, life-sustaining pathways of the heart and brain. Knowing the gravity of these risks is the first step toward reclaiming your cardiovascular health. Fortunately, your vessels possess a remarkable capacity for adaptation and repair, provided they are supported by consistent, evidence-based interventions. When we look at the foundation of this recovery, nutritional choices act as the primary defense. Research consistently highlights the DASH diet, the dietary approaches to stop hypertension, as a gold standard. This eating pattern is uniquely effective because it emphasizes the intake of potassium, magnesium, and calcium, minerals that act as natural balancers to the sodium that often triggers fluid retention and vessel constriction. Complementing these nutritional shifts, your physical activity habits serve as a form of internal maintenance. Studies indicate that structured aerobic exercise, such as brisk walking, swimming, or cycling, encourages the production of nitric oxide. By aiming for a consistent routine, you aren't just burning calories, you are mechanically training your vessels to be more responsive and less prone to the rigidity caused by chronic high pressure. However, lifestyle modifications are sometimes only one piece of the puzzle. ACE inhibitors, for example, function by blocking the creation of a hormone that typically causes vessels to narrow, effectively allowing them to remain open and reducing the workload on your heart. Similarly, diuretics help your body shed excess sodium and water, which lowers the overall volume of fluids circulating through your system, thereby easing the tension against your arterial walls. These medications are not a sign of failure. They are precision tools designed to stabilize your internal environment while you build healthier habits. Integrating a nutrient-dense diet with moderate movement creates a biological landscape where these medications can perform at their best. As you begin to implement these changes, you may notice subtle improvements in your energy levels and overall sense of well-being. Yet, even with these robust interventions in place, there is one final, often overlooked factor that dictates the long-term success of your vascular health. That final factor is the horizon of modern science itself. We are currently witnessing a profound shift in how we approach cardiovascular medicine, moving away from a one-size-fits-all strategy toward a more precise, individualized roadmap. Scientists are now investigating how we might silence the genes responsible for chronic vessel inflammation, effectively teaching your arteries to remain resilient against the wear and tear of time. This era of personalized medicine means that your treatment plan could soon be as unique as your own DNA, allowing for interventions that are far more effective and tailored specifically to your physiology. The health of your vascular network is not a static condition, it is a dynamic, living system that responds to every choice you make. When we synthesize what we have covered today, the message is clear: your arteries are not just passive conduits for blood. They are intelligent, reactive structures that thrive on consistency. These habits act as the foundational architecture upon which all future medical breakthroughs will build. Monitoring your numbers is not about living in fear of a diagnosis, but rather about staying informed so that you can navigate your life with confidence. The power to influence your long-term vascular longevity rests largely in the small, deliberate decisions you make each day. You are the primary steward of your circulatory system, and every measure you take to lower the strain on your vessel walls is an investment in your independence and vitality for decades to come. To summarize our journey, we have explored how hypertension acts as a silent architect of vascular damage, how the inner lining of your arteries functions as a protective barrier, and how lifestyle adjustments serve as your most effective defensive tools. By understanding these mechanisms, you are better equipped to advocate for your own health and maintain the strength of your vascular framework. This content is for informational purposes only. If you found this information helpful, please consider sharing it with someone you care about, as the gift of knowledge is perhaps the most important contribution we can make to one another's well-being.